Hi, Dr. Ebrahim Delpassand. Thank you so much for introducing us to the concept of Theranostics. Please introduce yourself and explain to us what is actually Theranostics.
Hi, Dr. Barken. Thank you so much for your question and the opportunity to have this videotape for your audience. I'm Dr. Ebrahim Delpassand, Chairman and Medical Director of Excel Diagnostics and Nuclear Oncology Center. I have been interested in Theranostics, which is a pair of diagnostic and therapeutic agents used typically for treatment of cancer in the last 20 more years. And I'd be happy to tell you more about theranostic agents that we have in the field of prostate cancer.
Thank you for the explanation about Theranostics. Since it involves agents of diagnosis and therapy, what agents are you using? How is the test being done? And what are the indications for this test? Is it available?
Thank you for your question, Dr. Barken. The diagnostic and therapeutic agents that we have at Excel Diagnostics and Nuclear Oncology Center are to diagnose patients who have diagnosis of the prostate cancer before, have undergone treatment, and now they are showing biochemical recurrence, which is increasing PSA in a setting of a patient who previously was treated. The PSA was either undetectable or very low, and now you see that the PSA is rising. This test is a PET scan. PET stands for positron emission tomography. It's a nuclear medicine procedure that can detect sites of the prostate cancer in the patient throughout the body. So we do a whole body scan, and whole body is from top of the head to mid-thigh area. The radiopharmaceutical that is used for this agent, for this test, is gallium-68 PSMA. Gallium-68 is the radioactive part, is a positron emitter, and the PSMA is prostate-specific membrane antigen. And the drug is an inhibitor of PSMA, which actually is expressed in the surface of the prostate cancer cells. So after injection of this drug, we wait about an hour, and then patient goes to the imaging suite. We complete the imaging in 35 to 45 minutes, and then at the end we're going to have images that we can evaluate for any sign of prostate cancer spread throughout the body. So that is a very sensitive test. It is the sensitivity and specificity is more than 90%. And this is probably the most sensitive test that we have available to us. At this point, the drug has not been FDA approved, and it is done based on an investigational trial under FDA approval for that allows us to perform this non-approved investigational test for our patients. The therapeutic pair of this medication is Lu-177 PSMA. So the Lu-177 is the therapeutic radioisotopes, which is attached to the almost same molecule, and after injection it goes and finds the cells that are expressing PSMA and attaches to those cells, tumor cells, and then internalizes, meaning going inside the cell and carries the radioactive material inside the cell. So this is a targeted radionuclide therapy because only attacks the cells that have those PSMAs and they are expressing the PSMAs. Therefore, this is why it's called targeted radionuclide therapy. Again, this is an investigational trial. It's not commercially available, but we are able to do this under investigational new drug application that has been approved by FDA. And it's more than a year that we are doing the therapeutic version, and more than 3 years that we are doing the diagnostic version. I hope this is helpful for your audience and people who are interested in these modalities. And please visit our website at www.exceldiagnostics.com for more information, or contact our office at 713-781-6200. Thank you for your interest in this program.